So for the reason we are here, we are so excited. We have Advocate Health of the Midwest region joining us today to talk about how they have transitioned to virtual conferences and really have just brought a ton of value to their nursing community around research, around projects, and they're really doing it in a cost-effective way. We have so many great ladies here to talk about their experience today. And so I'm going to hand it over to Cindy for introductions.
Thank you, Shelley, and thank you for hosting us today. It's an honor and a privilege to share with you today our journey. So I am Cindy Garza. I am the project coordinator for the Center of Nursing Research, Quality and Practice, and I have been with Aurora for 10.5 years. Sarah?
I am Sarah Marzinski. I'm the director of the Magnet program at Aurora St. Luke's Medical Center in Milwaukee. I've been with our system for over 20 years. Wendy?
Good afternoon, everyone. It's really a pleasure to be here. Thank you for joining us. My name is Wendy Tuzik-Mysek. I'm the Director of Nursing Excellence and Innovation for Advocate Children's Hospital and Advocate Christ Medical Center. And I've actually been at Advocate for over 30 years, so it is a pleasure to be here with you today.
I'm Vita Viscerta. I'm the Midwest Regional Director for Nursing Research at Advocate Healthcare and Aurora Healthcare. And I've been with the system for just a bit over 4 years, and it's wonderful for me to be here today with all of you. Thanks.
Awesome. Thank you, ladies, for your introduction. So Cindy, tell us a little about who you are and kind of what brought you guys together for this virtual conference.
Yeah, so we'd like to preface that in December of 2022, Advocate Healthcare in Illinois and Aurora Healthcare in Wisconsin came together with Atrium Health in the Carolinas, Georgia, and Alabama to form a newly combined system, Advocate Health. The information regarding the 2021 and 2022 virtual conferences in today's discussion only pertains to the Midwest region, previously known as Advocate Aurora Health. So to set the stage, in May of 2018, Advocate and Aurora merged into one healthcare system covering as far north as Marinette, Wisconsin, down to the south side of Chicago. We are 22,000 nurses strong that cover 27 hospitals and nearly 450 sites of care. We promote a culture of nursing excellence, and offering this forum for nurses to share their work aligns with that goal.
So what's the history of this conference? Tell us a little bit more about the background.
Sure, Shelley, I'll take that. Advocate and Aurora, as independent entities prior to the 2018 merger, truly had an extensive history of hosting and supporting in-person research and professional development conferences. Then once we merged as Advocate Aurora Health, we used our combined 40 years of experience to really continue to host conferences promoting nursing research, evidence-based practice, quality improvement, as well as professional development. Now, anyone who has been involved in conference planning knows that you begin planning for the next conference right after the last one, as hard as that might be. But therefore, it was very early in 2020 when we had begun to explore what's next, what venues could support our growth in attendance, what were centrally located between both of our states. That wasn't necessarily an easy feat. Then a little something called COVID disrupted our world. This disruption eliminated in-person events and essentially made the decision for us to postpone our conference in 2020. Now, ironically, at the same time, Advocate Children's Hospital was preparing for their in-person Magnet Recognition Program site visit, which was scheduled in March 23 to 25th in 2020. Now, needless to say, the in-person site visit was canceled. So knowing that our team's platform had just launched in February of 2020, which the timing couldn't have been more perfect. So I don't know if IT had a crystal ball, but we quickly pivoted and began focusing on executing and managing a virtual visit that took place then in July of 2020. We were one of the first sites nationally to host a successful virtual Magnet site visit using a virtual platform. So we had expertise built over time in conference planning and hosting large events virtually. And so we flipped that experience into creating a new virtual conference environment that we are currently working in now. So as we begin our virtual conference planning back in 2021, we modified a quote from Maya Angelou. We figured we'll plan for the best, prepare for the worst, and be unsurprised by anything in between.
Well, I feel like nurses are just fit for that. I mean, you plan for the worst and prepare for the best all the time. I'm curious, how did you know to switch to virtual versus just canceling or postponing? Kind of what was your thought process on that?
Maybe I can answer that for you, Shelley. With the initial COVID outbreak and then the continuing pandemic, we realized really that nurses needed an outlet to share some of the positive work and build connections professionally. And so the virtual conference was really seen as an opportunity to support nurses while also maintaining those important aspects of social distancing and also reducing cost. As the world moved over to virtual platforms for meetings, our nurses were also beginning to have some experience with the Teams platforms. When I think back, our team who formed to plan this conference realized that we needed to provide nurses with some sort of opportunity that would be positive for them at a time when the work and their own personal lives were really stressful secondary to that pandemic outbreak. So we were really looking to the nurses' well-being by giving them a respite and also creating some feeling of normalcy through an opportunity to share their work in the areas of professional development, research, quality improvement, evidence-based practice. And at that time, what we recognized was really important was COVID care innovations.
Mm-hmm. Yeah, all really great points. What were some of the challenges, faced in preparing for this and planning for it? I can only imagine there were lots of difficult decisions that had to be made.
That's a really good question, Shelley. The logistics for preparing a virtual conference were very different from those in person. We needed to consider IT support, connectivity for presenters, and practice runs for those who had never presented in a virtual format before. On the other hand, we didn't have to deal with catering, physical space constraints, or travel expense. So we ended up developing and holding practice sessions online for presenters and extended the timeline for content submission to really allow for the time to upload materials into a virtual platform. We collaborated with IT for individual support and troubleshooting, and we accepted without negativity that our participants and presenters may not know how to do this because we have a diverse workforce and diverse experience in the platform themselves. Now, in order to simulate the in-person conference experience, we had to use virtual reality halls and taught attendees how to utilize the chat for Q&A. Now, we tried to keep as much of the normalcy of an in-person event that included keynote speakers, podium presentations, breakout rooms, poster sessions, including a voting process for the best poster presentation. Now, we'll show you a little bit of this a little later in a demo so you can get a better sense of what we mean by a hall. Now, we had a Microsoft consultant, thank you, Aaron, the first year who provided a lot of support to help our ideas come alive in the virtual world. Now, after the first year, when we were doing a lot of it ourselves, we learned that the functionality of the platform could do things and were constantly evolving. So we quickly realized we needed a project manager with expertise who could stay on top of all those moving pieces. And in came Cindy. We were really good at putting on in-person events and really wanted to maintain that high level of quality and content in the virtual world.
Well, it sounds like it was a success. What were some of the benefits that you saw for your attendees, that were now virtual, that maybe they wouldn't have gotten, with an in-person conference?
So, the benefit was not only to the nurses who were attending the virtual platform, but in essence, it was really, there were many benefits associated with actually using that approach for putting on this conference. A virtual conference approach really eliminates many of those costs that are associated with renting a physical venue that then requires, calculation of the space cost, food costs, potential lodging costs for nurses who may be traveling from longer distances to attend the conference. We had combined our two legacy conferences just prior to this conference, which was the Professional Development and Research Conference. And so that combination made us realize that we were going to have a larger number of attendees than we had previously, which meant that venue that we would have chosen for the physical on-site conference would need to actually accommodate this increased number of attendees, which then obviously subsequently results in really increased costs, and those were substantial. Going virtually eliminated this aspect of the conference cost, which typically is carried over to attendees who have to pay an attendance fee. And for our nurses, many times that cost was picked up by the manager of the unit that they were working on. So we were really saving a fair amount of money in that aspect. Also, holding that conference in person was not always the easiest for our nurses who were geographically located further away from the venue, which then ended up being that there was time lost in travel, the need to accommodate with lodging the night before. And so really those were additional costs that we were able to save on for our attendees who may have been coming from Wisconsin and our northern regions or from our very southern Illinois regions. This platform also now allowed the nurses to attend either the full conference or for many of them who may not have been able to get that full day away from the clinical unit, they could attend portions of that conference, particularly ones that may have been of interest to them or a particular clinical area that they're best versed in. This also helps eliminate potential hardships on managers, clinical units, and the hospitals, particularly related to staffing and meeting patient care needs. But it also just benefits many more nurses who were able to attend that conference. Another benefit was that the selection of keynote speakers really eliminates costs associated with their travel and lodging. It also almost improves the pool of potential keynote speakers because many of those who are recognized keynote speakers have very busy calendars. And so sometimes it's really difficult to schedule them in, particularly if there's travel related for them. That's a 2 to 3 day commitment, where here it ends up being maybe an hour plus a couple of hours if they're working with us to train them for putting on their talk on the virtual platform. The other benefits were that one of the easier things for us is to actually just do a recording of welcome to the attendees by our system CEO, and then playing that versus having to require him to be at the conference site, given how busy their schedules are. I think the final one, really, when I think about benefits, is that given our current healthcare environment where we are seeing many more hospital mergers and acquisitions, so that we are having larger and larger sized healthcare systems, using a virtual platform really makes it much easier to, reach out to the number of nurses that can participate really, exponentially much larger. Wendy, maybe you want to address a couple of other ones?
Sure, thanks, Vita. I think in addition to some of those financial aspects, as well as the accommodation of the distance challenges, a couple of the other benefits was that the conference materials, including the video recordings, the handouts, and the posters, were all available post-conference, which provides ease of access for participants both during and after the conference, which is truly a nice feature for participants. If they didn't have time to go in beforehand, it's not like it's up there and then it's gone and they don't have access to it. And I think for us, in doing a in-person conference, trying to figure out that platform that's accessible by all, where you could load those documents, was always a challenge. I think additionally, the virtual space allows for those conference materials to live and be accessible by both those who have registered and even those who couldn't register for the event for as long as the organization determines. Previously, we would have them up for only a set period of time, but within the SharePoint spaces, it could be up there for 365 days before our next conference if we determine that's the best option. The last benefit, I think, of the virtual environment really extends the recognition boundaries in our ability to promote our teammates excellent work to a much larger audience. For example, all of our podium and posters were already in a digital format. So this year, it really allowed us to translate those into our digital repository, which allows for worldwide access and dissemination. So really an amazing feature that we wouldn't have had access or availability to in an in-person conference setting.
I love all of those benefits. Just like our podcast and webinar, we love sharing it, after the fact, and it's there for people to consume at their leisure or, later or come back to. So I love that you had that benefit. And we all through COVID learned how to embrace virtual experiences, but I'm sure there were some things you missed about being in person. What do you guys think about that? Will you go back to in person, stay virtual? What were some of your thoughts on the in-person side?
I think we're going to end up staying virtual. But we do miss that human connection and informal networking. That's really hard to achieve in that virtual world. Attendees had a more difficulty time connecting with their colleagues who they didn't know already, in the same way that they would if they were mingling around a conference center in real life. So for example, at an in-person conference, the poster hall's full of chatter with presenters and fellow attendees starting informal discussions on a wide variety of topics. And the first year we tried to promote this by using individual poster recordings and the chat feature with authors. And the second year we tried to host it with live Q&A with the authors. But we're always learning and adapting the conference to really build those connectivity and those connection opportunities.
Yeah, that is amazing. I mean, in person, there's just nothing like it. I mean, the physical, form of being around people and seeing them will just never be replaced by virtual. But it seems like you've really embraced the best of what you can get out of virtual, and I love that. You've talked a lot about this virtual space. I've heard you talk about halls. I think you mentioned SharePoint spaces. I know our audience would love to see kind of what you guys did. Can you share a little bit about that with us?
Sure, we would love to. Cindy's going to go ahead and share her screen and drive us through the site so our participants can see some of our screenshots and then go into our actual conference live site. So very similar to the virtual magnet site visit, the virtual conference platform does require a lot more preparation on the front end versus an in-person event where the bulk of work happens and occurs on the day of the event. So once we started with once communication went out to nursing that the registration link was open, the logistics team must begin managing really two different work streams. It was really the work to evolve the virtual site continued, but then we also had to manage the presenters and attendees who will be participating and living in that virtual space. So for example, the presenters, the logistics team, as I think Vita mentioned, ensured that the keynote speaker bios are available and posted on the virtual website, which you can see here from our last conference are right there in the center. And then we also spend time connecting one-on-one with our external speakers to ensure that they were comfortable with our virtual platform. Being able, can they share their slides? Can they understand where the chat function is? What will the moderator role be? So we really tried spending one-on-one time with our external speakers so that they had a comfort level coming into this. We also then hosted 2 live presenter training team sessions to allow our internal presenters for podium and posters who all had varying levels of experience with teams, really an opportunity to see the conference site and help them navigate the team's features, as well as the calendar invites to ensure the best results. Now, some of our internal presenters by nature of their roles, and we had been in our team's environment for well over a year and a half at that time, they did elect not to attend some of these sessions because they were very comfortable with teams and didn't need some of those basics. But simultaneously, as we were working on the presenter, continuing with the virtual site, we were also developing training for our moderators that were selected for each of our virtual sessions. Now, these sessions focused on Teams functionality because in a moderator role in a virtual environment, it's a little bit different because they have to manage the virtual environment. For example, during one of our keynote presentations, our keynote, even though she practiced, couldn't get her slides to share. So our moderator and our tech advisor quickly jumped in, and so we started sharing slides. So that was also a huge lesson. We needed to have access to everybody's slide deck so that we could, do that last minute kind of adjustment if needed. But so our moderators were really having to understand that virtual function, but also then in addition to that, those typical moderator functions that they would do for a session. Now, for attendees, we also monitor the registration link, as well as 4 to 6 weeks out, we uploaded the agenda that you see here, where they could view the agenda and the conference site, and we continue to build that agenda over time. So in the very beginning, we put that we knew the keynote speakers, and then once we had identified our breakout sessions, we built out the agenda so that people could continue to see how the day was evolving, so that it sort of gave them, piqued their interest and continue to drive them back to the site so that they had an idea of what that looked like. Now, 1 week prior to the event, we sent out an email to all attendees with the same message as our current homepage that included how to access the SharePoint site. It also how to manage the conference Q&A, how to obtain our contact hours, using our hyperlinks to drive everyone to the SharePoint site. They also had access here again if they wanted to relook at the bio, the full agenda. If they happened to stumble on this and didn't do their registration, they could do that. We also added the how-to video to navigate the conference site so that attendees can watch as many times as needed to feel comfortable for that day of events activities. And that was really a nice feature. Cindy was really wonderful. We created a very evergreen video so that we won't have to reproduce it based on, hopefully, Microsoft, the functionality of our Teams platform may change. So that would be the changes that we would have to adjust. But it was a great addition for everybody to, have their own time, rewind it, relook at it, so that they really built that level of comfort. So again, on the day of the conference, we shared the SharePoint homepage yet again with a simple picture of a door asking them to click to enter. So that was their way of officially entering into the conference as if they were walking through the doors of the conference center. So hopefully that's given you a little bit of idea of the front end of the conference and how we were able to navigate and keep our teammates interested in participating in the event and giving them new features. I think that that's really one of the great things, like we added a clock so that people knew what the countdown till the conference was. I think that that was for us as the conference planning team as well as our attendees. But also a lot of the great features that Cindy was able to put on the right-hand panel so that people had the opportunity to go back and forth with. We were able to add and upload our abstract, our call for abstract, the save the date flyers, many of those things that otherwise we would be pushing out to our leaders to communicate, hanging them up in different venues and staff meetings. So it really was a great feature that really was centralized where we could load all of those resources.
Now, before we go into the door, I do want to say, I want to back up and show you that we actually took advantage of this site for some key elements way before the conference opened. Vita, do you want to go through some of those initial setup screens?
Be happy to. So, before the day of the conference, there was also a lot of prep work prior to that day. And some of that was really following a conference approach where we requested the nurses who did work to submit abstracts. And so we used this SharePoint page as a central site or repository for those abstracts. The screen here shows you that where there was a way for abstract submission, it said learn more. There was very highly developed guidelines for what abstracts had to look like in terms of their format. There was an actual link to input that information. We then also created an abstracts video that sort of gave the individuals who submitted an abstract an understanding of how those abstracts would be reviewed by a blinded panel. So that stayed up for quite a while during that time period that abstract call was open. Now, once we actually had submission of the abstracts and that was completed, we then moved on and changed those pages out where there was an abstract review process also identified here. And then the next panel would actually show how the homepage changed and we were able to announce the presenters. So this page then flipped over and gave an opportunity for those who were selected as presenters, either be it a podium or a poster, additional information of how to create that presentation. We have pre-formatted templates here at our healthcare system that address research and all those different areas of scientific inquiry work that the nurses did. They could access those templates directly from this site instead of trying to figure out where it was throughout the system. We also then provide an opportunity here for the nurses who were going to be collecting continuing education units for attendance at the conference, all that information that they needed to do. But at the same time, it was for our presenters to be able to complete some of that information that is required when one submits for the ability to hand out continuing education units.
Excellent. Thank you. Cindy, do you want to take us through those doors? Since our SharePoint spaces or SharePoint sites are open to everyone in our organization, technically anybody on the day of the event could click on that set of doors and join even if they didn't pre-register. But once they were inside the site, we had it laid out from left to right so they could really see the whole agenda in front of them and know when to join the different events. We hyperlinked different Teams meeting events so the attendees could click on that event to join it at whatever the appropriate time was, and then move through the agenda throughout the day. And we found that frontline nurses were not tied to Outlook calendars the same way as our nursing leaders. And so we had to make access really simple. We didn't want them to have to come in and out of the site to get to the different events or to go between this SharePoint Spaces site and their calendar. And it also allowed the flexibility to attend when they could. Now we hosted a poster hall that they could view at their discretion. And it had a whole bunch of different posters from various different practice settings. And our full agenda reflected the 4 poster categories that Vita referenced before. So they could look at these different slides and pick whatever suited their fancy on that day, and then would be able to link to the poster room in the category they wanted to see. So you can see it would build the virtual hall, and then they could look around that room to see all the posters in that category. Once they wanted to see a video or a poster that they were interested in, they could click on that poster. They could make it bigger to see the full PDF, download it if they wanted to, save it, send it to a friend. Obviously, this was all internal to our organization, so we were able to really share good information across different venues of care. Now, the poster hall was one area that we really hope to improve in the future. Because the live Q&A or the recorded sessions were a little tricky to really get that interactivity that we were looking for. But they did get to vote for the People's Choice Award for their favorite poster. And we allowed that to be announced then at the end of the session. Now, once the posters were done, they would go back into the main hall and they could go into different podium and breakout sessions that were live Teams meetings. Built on the same premise as the poster hall, where they could see which sessions they wanted to go to, in which room at what time. They could potentially move from breakout session to breakout session if they wanted to, or they could stay in the same room for those 2.5 hours and watch the 5 presentations in sequential order. Now, the presenters were invited to join via Outlook invites so that they had the speaker privileges. We were allowed to highlight them and make sure that they had their cameras on, their mics enabled, they could talk and share their screen, whereas attendees had their cameras and mics disabled to eliminate some of the distraction. We used the Q&A function within the events to really be able to pose questions for presenters and keep everybody on time. But another way that we can continue to improve as we go into the next year. Vita, I'm going to pass it back off to you for what we did after the conference.
Thanks, Sarah. So, the conference was the day, but it doesn't end there, because what we did is we built out a SharePoint page that the nurses had access to, which was really the post-event information page. And what was done here is we uploaded all the recordings of the keynote speakers and the breakout sessions. Also, the posters were uploaded here so they could still be accessed by the participants or those who were not able to attend the conference that day, but still would have access to the information. Of course, with the caveat being that in the state of Illinois, to actually obtain the continuing education units for nursing, you must attend the conference in full on the day of. So participants in the post-event state would not receive those CEUs, but still have access to all the information. We also use this as an opportunity to highlight who the poster winners were, so that recognition continued. This page is now staying up and continues to be accessible to nurses until we are ready to start that planning and pushing information out for the conference for this year, which will again be in a virtual state.
Well, I just have to say, I am incredibly impressed personally. I am a technologist, and what you guys have done is just blowing me away. It's so amazing. I absolutely love it. I do want to tell the audience, we are getting towards the end of kind of our curated content, and we definitely want to open it up for questions. So we have the Q&A panel there. So if there's anything that you want to ask of these ladies, the time is now to go ahead and get your questions in. So as we're wrapping up, I just one final question for you all. I mean, it seems like there are tons of benefits to virtual versus in person, but final thoughts, like what do you think? Are you gonna continue this staying virtual? Would love to hear your opinion.
So I think I'd like to start out by saying this is definitely something we want to continue with, this virtual event. I think where we stand right now, having now integrated with another health system, the number of nurses that we are reaching now has really increased. So this is really a great way for us to continue that work, continue that ability to recognize nurses, but now do it in a way that goes from 22,000 nurses to what's the current number we're at, about 40,000 or so above. And so it's just a great way to be able to expand that knowledge and that recognition to so many more nurses, and particularly those that now are part of the group that we are. And then Wendy, maybe you have something else?
The challenges are virtual, so I guess that is one thing. But anyway, I think because the virtual platform, it really engages all levels within our teammates, and it also provides the flexibility that's needed to maximize their time, which I think is a critical element in today's world. Everybody is working so many, having additional responsibilities and trying to juggle it all and squeeze in that professional development. This really gives them really quick access, either on the day of or post-event, to be able to generate and get that knowledge that they might be seeking. So I'll turn it over to you, Sarah.
Yeah, I really do think that the virtual platform allows us to really have global participation and really reach a larger audience that we would never be able to help transport across the nation to an in-person venue. Cindy, what are your thoughts?
Yeah, so I would say that the virtual platform just really gives us this amazing opportunity to be creative and innovative, that we can be inclusive, and then and echo what everyone else has said about sharing the knowledge to help our nurses in their practice and their professional development journeys.
I've got a question for the group, and this has been great. Thank you so much for your participation today and sharing your story with everyone. And I had such a joy working with you all on this. But one question I had, do you have any kind of anecdotes or comments that you heard back from particular nurses about their thoughts, their feedback on this this new format?
I know I personally heard the wow of the virtual spaces. They had never been in a room that they could literally spin and see 20 posters in a room on a computer screen. And while some of us are too old to experience virtual reality as a kid, some of our newer nurses really just dove into that with gusto and thought this was a great opportunity to see a hall without actually going into a physical space.
Nice. And I remember during the project, you made mention that in terms of the cost savings of this, approach, that some of those cost savings even impacted individual nurses. Is that correct? I remember you sharing that some departments might have covered some of the expenses to go to the old in-person format, but not always. And sometimes nurses would even have to sort of come out of pocket for, in-person events, and that this changed that in a way for them.
Absolutely, Erin. I think that was probably one of the top benefits that we achieved with this virtual platform is that, particularly now at a time when cost savings is top of the list in these economic times, is for nurses to have the opportunity to attend conferences. That's really limited depending on how much it costs. And the fact that, we took 2 different conferences and put them into one and sort of brought, material that was addressed in more the professional development and then also material and research and put it together, it gave nurses really the opportunity to get double the bang for their buck, as they say. I think also for many of the managers, it was an understanding that, yes, when they are trying to look at budgets and supporting nurses in their development, those dollars really add up. And so this is an opportunity to not only have the nurses attend for their own professional development, their own opportunity professionalism, but it's also giving a lot of nurses an opportunity for the first time to do a presentation. And that's wonderful.
Mm-hmm.
And that, with the cost saving plus that, the rewards are really quite high for us and for them and for the system. So.
I would just want to jump on to what Vito said. I think that the aspect of some of our clinical nurses not having had the opportunity to attend a national conference, having the ability to attend our conference, which is a very largely attended conference. We had almost over 500 people that registered, that attended, that gained access to the work that our teammates were doing. And that's really, really powerful. So I think that the aspect of giving our clinical nurses a sense of confidence that, wow, my abstract was accepted, I was able to present at this conference, it gives them that confidence to reach out to that next level of presenting either regionally or nationally or internationally. So I think that is another huge benefit of the conference that we've designed for Advocate Health.
Yeah, I have a question in kind of parallel to some of the chat comments. I know Erin helped you, and we as Microsoft always want to support our customers, but you have to be willing to learn. Kind of, you are nurses at heart. You weren't trained on technology. How did you figure this out? Did you lean on IT a lot? How did you go about training yourselves so you can train others? What did you guys do there?
So Shelley, I guess I'll start. I think one of the key aspects of that is knowing on the front end, even as I started with the magnet site visit, it was really reaching out to Microsoft and saying, okay, what resources can do you have to help support us, to help train us, to get us to a level of comfort where we can manage some of the functionality of Teams? And, 3 years ago, the Teams platform looked very different than it is today. So I think having that training experience really helped. That gave us a little bit of confidence that said, yeah, we could do this. When Vita called and said, what do you think? Could we do this? And I'm like, yeah, I think we can do this. And then I'm thinking, then once I knew Erin, I said, okay, Sarah, let's partner in this so that, because there was a lot more to a virtual conference that was not anything that was similar to a magnet site visit. So I think as we reached back out to Microsoft and said, okay, we want to explore this, it was really a great partnership. And then slowly, as we learned in our first year, we did need to connect with our SharePoint IT experts. And really, IT had some knowledge of the virtual expectations from the magnet site visit. So they were really open to partnering with us as we explored our next steps. And I think it helped that, Erin knew our team here from an IT perspective. And, we had conversations and emails going back and forth. And it was a huge learning curve. And I'm going to say, like you said, Shelley, we were trained as nurses. And I know I hand my phone to my son when, the screen goes haywire. So it's like when I said, yeah, I'll do this, I'm thinking, what am I doing? This is not you, Wendy. But it really, I think you quickly understand your limits and you quickly understand where you need to get resources and help and support. And again, being able, as Cindy described, continuing to evolve this and innovated and created is something that you have to look at what you did, get the feedback from your team, and then continue to evolve it so that you adjust. And that's one of the nice things about the platform, that you're able to keep evolving it and changing it so that it's meeting the needs of your presenters as well as your attendees.
Yeah, I would also add that nurses are intrinsically curious. So if you give us something and you say, like Erin did, hey, have you seen Spaces? And I go, I've never heard of that. And he goes, well, here's how to get to it. And I was like, okay. So then I had to play around and build a fake space and bring it to the steering committee and say, hey, what do you think? Can we use this for posters? Like the MacGyver of healthcare frequently is nurses.
Yeah.
And so we had to test it out and try. It was really good. And honestly, Cindy really helped it come alive the second year because she did the heavy lifting of investigating what had changed, helping us test out different tactics.
Yeah, I love that. So one more announcement to the audience. We have wrapped our official content, but we've actually opened up the mics. So if you don't mind, raise your hands if you have a question, and we'll call on you if you want to ask a live question. And it looks like Vasu on our team has a question. Do you want to go ahead and ask live?
Yes, please. Yes, Shelley, thank you. And what a fantastic presentation. Thank you, team. This is going to inspire so many of us to run virtual conferences. I was going to ask, what are some new layers that you're looking to add in the future, like in the next year's conference? Or I'm sure others internally would have reached out to you and asked you for ideas. So what are some new elements that you want to add to this virtual experience? I would love to, get some ideas.
Well, I think one of them is in the poster world, Sue. I think as Sarah and I continue to evolve our that poster space, it's really that interaction with our poster leaders. And we quickly realized year one that the chat just didn't work. And so then we put everybody in a room and we quickly realized we did not have enough time for people to pop in and ask their questions. And then they were wanting to see the poster and the people at the same time. So I think we're learning that we're going to have to do more of like a Brady Bunch of the actual posters so that we can pull them up during the poster chat and really either design it so that we have specific people that have a set window of time to do an actual physical presentation of their poster and then allow time for Q&A. So it was really, I think, a focus of being able to expand that poster session this year that I think is going to be one of the main changes that we're going to look to expanding.
Sure. Thank you, Wendy.
Yeah, and I would add that I think we have a really good opportunity to build networking in there, whether that's some kind of open session, like here, have breakfast with your friends and do either games or interactive like icebreaker activities so that people can learn a little bit about their fellow attendees who they don't know in real life or are at a different hospital site.
Yeah, Aaron, you
Yeah,
have your hand up. Thanks.
I do. It's been actually a question I've been meaning to ask the team. I've been curious. Now that you've done 2 of these virtual events, right, last year and this year, I assume that it's probably got some awareness and some looks from other maybe departments within the health system. Have other groups approached you and commented on, hey, that's a really neat concept. Maybe we can look at doing the same for another area, of the health system that might have virtual conference needs. Has that come up at all, or have you heard any feedback like that?
Wendy, have you? I haven't, but again, I wanted to say that Wendy and Sarah from our steering planning group on this really are what we call them the techies. So they really embrace this virtual platform. And I, at this point, is still learning from them as I, excelled in another area of planning this. So I think I would have to look to Wendy and Sarah because they promoted this, they learned it, they showed people how cool it was. And I think, in some aspect, even though we may not have heard some feedback, I think it was really promoted at our system. The fact that nursing did this virtual conference, we really expanded it this year. And then we did it with a platform, understanding that last year we may have been the first to do this and use this approach. So I think that really has been messaged out. Maybe others are still a little leery to take those steps where, as Sarah was saying, we nurses will jump in, give us something new and we'll try it out. So.
Yeah. Well, and to that, point about, trying it out, I'm sure some of our attendees might be thinking about trying it out, within their organization. And to that point, what advice would you give to other organizations that are thinking about, looking at how to convert one of their in-person conferences to virtual?
I would say, oh, go ahead, Sarah.
Have a project manager. So you're not allowed to have Cindy, but you need to have a Cindy, and you need to be able to find your resources that really help it come together as a team. Like nursing was committed to having a conference because we had always had in-person conferences before. We weren't willing to give that up despite the national environment of the pandemic. And some other departments have either decided, okay, we're just not going to do it anymore, or they have gone back to in person and had canceled for a couple of years. And I think because you just have to be willing to try something out and get the backing and the resource support that you need to make it happen.
Great.
I would just add, you could clone Cindy, but you can't have her, as Sarah said. But I also think you just have to be patient and have a team. Because I think you know what you know, and sometimes in this case, you don't know what you don't know. And I think if it wasn't for Cindy's guidance, Aaron, your guidance, I think that's where it helps us be better in terms of the functionality, in terms of how we can wow our attendees and our audience. I think, as Vita said, it did get a lot of attention at our executive level and within our leaders. But I think, again, I have not heard of any other department really taking this on, but because it's been part of our culture within this nursing environment and the value and the importance of the dissemination of the work that our 20,000 nurses are doing in the Midwest region, we really felt committed to continuing to provide an event for them to be able to do that.
Great.
I would like to add, not to be afraid, just think outside of the box and know that it'll all work out. Plan and be innovative.
One
think
thing I
that-
saw. Oh, go ahead,
Oh,
Vita.
no,
please.
sorry. I was just going to say, I think in that respect, part of it is too that, you know, when you think you're going to a virtual and you're not familiar, you're uncomfortable with that process, is not to lower the bar for the way your conference will be. For us, it was, we wanted this to be like as if you went to a national conference, the abstract submission, the selection, breakout sessions. And I think for us, it was, you know, we raised that bar high because we wanted to be there. The challenge for us now every year, I think, is what do we do to keep raising it higher and higher so that it is a better and better conference. So
I love that, Vita. And I think it ties to what Cindy said about don't be afraid. I saw that this group, you were not afraid. You looked at how did we deliver the in-person conference? What was every element of that? And is there a mapping we can do to the virtual side? And you found one. In every case, here's how we're going to make sure we bring that to the conference virtually. And now you're looking at beyond. Well, now that it's virtual, how do we make it even better, right? Do things that maybe weren't possible, you know, in person. So it's exciting.
I think one of the other key tactics that we used is we debriefed after the conference, which I think is hard to do, but I think it really identified some of the areas while it's fresh in your mind of things that you want to capture, things that you want to change. I know even this year, Cindy added a tech role to each of our sessions, which we didn't mention previously, and that was new this year. And it was really nice so that the moderators could take a little bit of a deep breath if they weren't super comfortable with Teams, that they had a tech person that could jump in. But we realized that some of our tech people were not trained all at the same level. So that will be an area of opportunity for us to increase their confidence in understanding of the platform that they're in so that they can jump in at the last minute if needed.
Yeah, just you guys are blowing me away. I absolutely love your story and what you have done. And thank you so much for sharing it with our audience. Just like your conference, we're going to post this session. It'll probably be early next week when we get it posted. And so we'd love for you guys to share it out with your colleagues. I also wanted to just give one call out. We recorded a session last week with 2 practicing physicians, one from Baylor Scott and White Health and one from Nemours Children, around how they're being innovative with technology around virtual and asynchronous care. So please be looking for that one as well. It's going to just come out as an on-demand podcast. Also, we've posted in the chat window a form that you can fill out if you'd like to get future sessions on your calendar. And so we do have a couple more customers lined up for late March, early April. And we are so thankful for all of you coming and sticking on with us, and hope to see you on our future sessions. Thank you, everybody, again, and have a great day.